This is a step-by-step video instruction on photographic skin lesions while taking teleconsult. Follow these steps to ensure photos taken are of good quality. Use the camera application of your smartphone. Do not use any filter while taking the photographs. Also, do not edit or crop the images. Photos should be taken in daylight preferably. If not possible, keep the flashlight of your camera on. To focus the camera, tap on the screen of the phone. Do not tilt the phone while taking the photographs. Photos should be taken against a neutral background, either a wall or a plain bedsheet. Ask the patient to undress completely or wear minimal clothing so as to photograph all the areas of the body. Take minimum 3 images of each side. To demonstrate overall distribution of the lesion, stand at 2 arm distance from the patient. Ask the patient to stand against the neutral background with both the arms by the side of the body and palms facing forwards. Take minimum 3 images in this position, covering head to toe. Now, ask the patient to turn around and take photographs to cover from head to toe. Capture images of left side of the body. Ask the patient to turn towards his right side. Keep his arms overhead with the right leg forwards in the walking position as demonstrated. Now, capture the images of left side of the body, covering head to toe. Similarly, to capture the images of right side of the body, ask the patient to turn towards his left side with the left leg forwards in the walking position and arms overhead. Now capture the images of right side of the body. Now, to take close-up images, keep the smartphone at 2 hand distance from the patient. With the patient looking forwards, capture the image of face and neck. Then, ask the patient to turn his neck towards right side and take the photos of left side of face, neck and ear. Similarly, capture the images of right side of the face, neck and ear. Now, ask the patient to extend his neck by looking towards roof. Now capture the images of the neck in this position. Now, with the patient standing straight and arms by the side of the body, capture the close-up images of the chest and abdomen, thighs and legs separately as demonstrated. Ask the patient to turn around and take the images of head and neck, upper and lower back, thighs and legs separately. Now, ask the patient to turn towards his right side with the arms overhead and right leg forwards in the walking position. Capture the close-up images of the arms and chest, abdomen and buttocks, thighs and legs separately. Similarly, capture the images of the opposite side. Now, ask the patient to lie down on a bed and take the images of sole of the foot. Ask the patient to fold his leg at knee joint and separate the legs to capture the images of the lesions over genital area. Instead, patient himself or herself can take the images of genital area. To take the images of hands, ask the patient to place both the hands over bedsheet side by side. Capture the images of both palmar and dorsal surface of the hands. To take images of the scalp, ask the patient to sit on a chair, use spatula or comb or a finger to separate the hairs and capture the images of the lesions from above, back, right and left sides to cover the entire scalp. Thank you. This is a step-by-step video instruction demonstrating photographing oral cavity lesions of the patients while taking teleconsult. Ask the patient to rinse the mouth with the water before taking photographs. Use the camera application of your smartphone. Do not use any filter while taking the photographs. Also, do not edit or crop the images. Keep the flashlight of your camera on. Tap on the screen of the phone to focus the camera. Ensure to take minimum 3 images of each side. Ask the patient to open the mouth wide and protrude the tongue out. Capture the images of upper surface of the tongue, holding the camera parallel to the surface of the tongue. Then, ask the patient to touch the tip of his tongue to the right cheek and capture the left lateral border of the tongue. Similarly, to capture the images of right border of the tongue, ask the patient to touch the left cheek with the tip of his tongue. Then, ask the patient to touch the roof of the mouth with the tip of the tongue. In this position, capture the images of undersurface of the tongue and floor of the mouth. To capture the images of inner surface of the right cheek, ask the patient to open the mouth widely and then with the right little finger, drag the cheek outwards. Now, Capture the images of right inner cheek standing from the left side of the patient. Similarly, capture the image of the inner side of left cheek. Capture the images of upper gums and inner surface of the lips. Ask the patient to invert the upper lip, holding with the fingers as demonstrated. Now capture the images. Also, capture the images of the lateral parts of upper, right and left gingivobuccal sulcus as demonstrated. Similarly, invert the lower lip and capture the images of lower lip, lower gums and lower gingivobuccal sulcus. Now ask the patient to open the mouth widely and look upwards towards the roof. Take the photos of roof of the mouth. Then ask the patient to depress the tongue with the spatula or handle of the spoon and make loud sound ah. At this position, capture the images of posterior part of the throat. Thank you.